Healthcare story.
I'm actually going to give you my point of view as to what I think should be done. Let me identify myself. I am a cardiologist, internist, and primary care physician up here in the general area. I've been doing this since 1981. I graduated medical school in 1974, so I think I have seen virtually every slice of what's been happening since that time. And I think that any physician that doesn't think that our current healthcare system is immoral and blasphemous is somebody who shouldn't be practicing medicine. The system is horrible as it exists. If this goes directly to Mr. Obama, let me just say that there is only one option. It exists in all of the civilized world except this, and that is single-party payer health care for everybody. And I emphasize the word health care, not health insurance. We do not need health insurance. Competition should not be for insurance plans or by insurance plans. Competition used to be by physicians for patients and by hospitals for patients and physicians. That is where the competition should return. The decisions that I am asked to make on a daily basis regarding health care are horrendous. Let me give you a quick story. This is not, unfortunately, atypical. I saw a young man in my office the other day whom I hadn't seen for about 9 months. He was supposed to be back in 3 months. He didn't come back because, in this economy, he lost his job. This fellow's been working all of his life. He's about 38 years old. He's a diabetic of about, had his diabetes under beautiful control. And he came in, he had lost about 90 pounds, which actually served him quite well. He was quite overweight. But the reason, very simply, that he lost 90 pounds is that he was off of all of his medication because he had no money. He has 4 children. He is back living with his parents, his wife, and his children. He hadn't yet gotten into any new health care system. I know Massachusetts now has a new health care system, but that was not available to him at the time. He came in, his blood sugars on average were 500. The reason he lost 90 pounds is he basically pissed his body away into the toilet. That's what diabetes is all about. God knows what he has done to his vascular system in the intervening time. It horrified me. I emptied my sample closet of what I had at that time. We worked very hard. We got him onto a welfare type of program. This is not a unique story. This is the story of this country. This is not a good country. This is an immoral country. It's a country that has no heart, doesn't care for its citizens, doesn't care for the least well-off. And I think in these hard times, people are suddenly beginning to understand the other side of the story. A single-party payer system actually is not only moral, it is actually cost-effective. We have a system that is anywhere from 30 to 50% more expensive than every other healthcare system in the world. We do not produce better healthcare. We produce tons of unnecessary tests and procedures. We hurt more people than average, and if you look at any 20 major health outcomes, be they any cancer outcome, any OB-GYN outcome, any cardiologic outcome, the outcomes are as good, if not better, in all of the civilized countries of the world compared to us. We are way behind the 8 ball. We are paying extraordinary amounts of money. Anybody who thinks they're not being taken for a ride is a fool, I am sorry to say. The insurance companies would not be in this were they not making a good profit. I guarantee you they take 10% off the top for their profit. Their overhead is another 10 to 15%. And anybody who thinks that the health insurance companies are efficient just knows nothing about health care. The other day I heard one of our esteemed senators, Lindsey Graham, once again bemoan in the usual Republican ideologic way that, by golly, you don't want to trust the bureaucrats to run this. After all, they can't run anything efficiently. I think this is a man who has no idea of what's going on in the healthcare system. And not only that, He's basically a bureaucrat. Why should I trust him if he's telling us not to trust the governmental bureaucrats? We have to trust somebody. What I would say to you is the vast majority of physicians, not all of them, but the vast majority of physicians are honest, they're hardworking, they're honorable. We kill ourselves, we bend over backwards. My average day starts about 4:30 in the morning and ends at 8 or 9 o'clock at night. And that's just purely in the delivery of health care or the record-keeping of health care. And if you don't believe me, you can ask my daughter who's sitting on my lap what time I leave in the morning, what time I get home at night. And I'm not holding myself up as anything atypical. This is, and I'm not bemoaning what I do. I love what I do. But the system is a bad, broken, expensive, immoral system. We have too many specialists. I happen to be one of them. However, I do a ton of primary care internal medicine, and I can tell you that the pyramid is upside down. We need many, many, many more internists and pediatricians and primary care doctors. Left system. We must change the malpractice system. Contrary to what the lawyers of America will tell you, the malpractice system is a huge thorn in the side of healthcare. It does not benefit the patients. It does not really reward families for their pain and suffering in any good defined way. It doesn't appropriately punish the physicians, or at least remove physicians who should be removed from practice. I can tell you all of this. The entire system is broken, top to bottom, side to side. One of the biggest problems, I'm sorry to say, is that I see very little physician representation in any of the healthcare policy decision-making meetings in Washington. We are all aware of the fact that in the latest meeting with Barack Obama, the single-party payer option was excluded from the table. I think, Mr. Obama, if this ever gets to you, let me talk to you very directly. You have to stand up and fight for what you believe in. Don't compromise with the Republicans. The Republicans never compromise with the Democrats. Never. They are street fighters. You need to kick them where it hurts. Believe me. If you believe in what's good for the people of this country, and if you believe in good economics and good policy mandate that we have a single-party payer system. We remove insurance companies, all insurance companies, every single one of them. There's no such thing as a non-profit insurance companies. The non-profit insurance companies have CEOs making over $1 million. I would love to make over $1 million and not have night call, not have weekend call, not have any legal liabilities. That's not my life, Mr. President. Listen to me and please believe me. And by the way, there was an article in the New York Times today, I'm sure you're an avid reader of the op-ed page by Nick Kristof, saying that you should listen to your own doctor, the internist that you have gone to for 20 years in Chicago, who is saying exactly the same thing that I'm saying. I'm not a lone voice in the wilderness. Do not pander to the AMA. The AMA probably represents less than 10% of the doctors in this country. It's a shameful organization with a terrible record. It should go out of business tomorrow. It doesn't represent me. I have never belonged to it. I never will belong to it as long as they have supported the kinds of policies that they've supported. I thank you. And I'm happy to talk to you any other time you want.